Hi, so for this case study project, I picked George's case. So my diagnosis for him is gallstones, and let me just walk you through how the diagnostic process worked. So I picked the case that I thought was the most challenging for me because I wanted to learn the most from it. But the disadvantage is that I actually didn't know where to go from there after reading his case file. Some diagnostic possibilities that I found is lymphedema, appendicitis, amyloidosis, cellulitis, and erythromelalgia. And all of these diagnoses sort of didn't really ring a bell for me because they're like sectioned off to different symptoms. And if we were going to this route, we would have to diagnose him with everything to explain why he's dealing with all these symptoms. So some of them talk about rashes, patches, some of them talk about swelling and inflammation, some of them explain fatigue and appetite loss. And appendicitis is not even like the right section of the abdomen, I realize. He has upper right quadrant pain and not the other side. So um, how I found gallstones is that I was actually talking to my friend, and our teacher overheard, and she happened to be somebody that was dealing with gallstones a while back, and she explained to me that there's actually five F's for criteria of people that are especially vulnerable to having gallstones, and that's fair, female, fat, fertile, and 40. So fair as in Caucasian, George is Caucasian from the image that we're shown. Um, Even though he's transgender male, he could be still biologically female. Even if you're taking hormone therapy, you're still biologically female. So, and he's also fat. He's dealing with diabetes and he also has obesity. I looked at the stats and the weight seems pretty alarming. So I did a BMI check and he's actually 33 on the BMI scale. And you only need to be 25 and over to be obese. So he's very far on that spectrum. He's over 40 because he's already 57. Diagnosing him with gallstones will explain his upper right quadrant pain, his fatigue and weight loss, and the high cholesterol. There are two types of gallstones. One is called pigment slash like bile gallstones, which just comes from the bile and is usually black, and the other one is called a cholesterol gallstone, which are usually yellow, and I think that's the type he's dealing with. Um, some factors that increase risk of gallstones include diabetes, high cholesterol intake, and being sedentary and obesity. And he had a myocardial infarction before, which means there's too much fat in his vessels and his blood can't pass through properly, which is already pretty alarming and just sort of intensifies the fact that, yeah, he is dealing with being fat in general. Um, so how do we disregard the other symptoms? I looked at gallstones and then I looked at the case file again after I settled with a diagnosis that a lot of other things aren't really explained if we just talk about gallstones. But I realized that dark patches, um, they could be a sign of acanthosis nigricans or AN, which is a symptom of diabetes. Sweet breath and ulcers are also a symptom of diabetes. And then reduced skin turgor and capillary return can just come from vomiting or diarrhea associated with the pain he's feeling. If he's vomiting a lot, he's losing a lot of fluids, which means he's going to be dehydrated, and that causes reduced skin turgor and capillary return. Um, and for treatment, I suggested removing his gallbladder or cholecystectomy. You just fine without the gallbladder, apparently. You function just fine. And then bile will just flow straight from your liver to your intestines. And that helps you with your digestion. And my justification for this treatment, including side effects and other options I'm not recommending, is that the pain for him is very imminent right now. He's lost a lot of weight and he's also dealing with a severe diabetic issue. Medications are a solution, but they'll take months or years or not even work. So I think surgery is the most reliable for him. Some other information to keep in mind is that I would order for an abdominal ultrasound to make sure that he actually has gallstones, before we suggest surgery. I would also, after that, start in treating his diabetes more intensively. He's already starting to get to the 60s range, and I would hate for him to deal with more problems with being an elderly, in addition to his diabetes and obesity. So I think I would need to gently but firmly recommend that he changes his living standard. He needs to avoid fatty foods and start exercising in general. Even if it's small, like the weight loss he's dealing with was probably doing a lot to his energy. So I would suggest starting really slow, but starting nonetheless. And then intensive diabetes therapy to make sure that it's not getting any worse, because I feel like the ulcers and the sweet breath is a really bad sign of how bad his diabetes is getting. So I think once this gallstone matter is dealt with, we can move on to diabetes and just focus on that. And I recommend that he check in with his physician very often. So yeah,